Happy Friday, everybody, and welcome to everyone's favorite show about plastic surgery, health, and beauty. This is Nip Talk. On today's episode, first off, Lindsay Lohan crashing the internet with plastic surgery rumors. We're going to go over all of that and see, did she have plastic surgery? Then, surgery to change your eye color? What kind of sorcery is this? We're going to talk about it. And then finally, what's this huge controversy with Blue Cross, the insurance company, and anesthesiologists? What's it all about? We're going to discuss it, and it's all coming up right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk, an honest and uncensored show about plastic surgery, health, beauty, and lifestyle with your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Welcome back, everybody. Thank you guys so much for tuning in. We really do appreciate it. Please hit that like and subscribe button. Turn on those notifications. It helps us so much. I'm your host, plastic surgeon Dr. Bruce Hermann, and with me, as always, is amazing Sarah, who looks awesome today.
Oh, thanks.
I love your outfit. You look so good. Trey, you look good also. Trey in the box.
I appreciate you.
You always look very stylish.
I appreciate you. I wanded my hair today. So.
You did? Wow. Is that like a long process? Or?
Yeah. Well, no, not really. It's shorter than you think.
Is it? Okay.
Yeah, it's shorter than you think. I wanded it.
I think people think I spend a lot of time on my hair, and I really... Do you think I spend, or do you think it's not?
It looks like you put stuff in your hair.
I do.
Like
I do put stuff in my hair, yeah. I just like put a little bit of wax and just kind of do like this, and I'm like, does that look good? And it's like, maybe not. Then I just kind of do it again. But then when I come here, it's like I'm always after surgery, right?
You have to wear like a little
I have to wear the cap, and so it smashes my hair, and it's just a process. So then I have to go and like refix it. It's a struggle, man. The struggle's real. I probably should just go back. I used to have a Caesar cut because that was just so easy to maintain.
What is that?
A Caesar cut? That's where it's like really short and just comes forward. Like Eminem's got a Caesar cut.
Oh, yeah.
Yeah, Caesar cut.
So like
Julius Caesar.
Yeah, I was like, I didn't know if that's what it meant. Was like how Julius Caesar's haircut
Yeah, sure,
was.
for sure.
Okay.
Yeah, I had a Caesar cut for many years. In college, I had kind of the long Kurt Cobain hair, which was pretty cool. And then, I can't remember what I had in med school. Probably something just a little bit more ridiculous. And then
Well, returning the favor, you look very good as well.
Oh, thanks,
Dr.
Trey.
Hermann today.
Thank you, sir.
Absolutely.
You are a gentleman and a scholar, and there's few of us left.
Right on.
So, man, I was going to talk about something like in the intro now, and I forgot. I like derailed it with
The compliment got you.
I did. I got thrown off.
Yes,
what were we? Man, there was something that happened, and I
don't know.
I don't know what it was. I mean, let's see. There was
Christmas break, maybe?
There was Thanksgiving.
Oh,
We haven't had Christmas yet.
Christmas is coming up.
right.
Yeah, Thanksgiving. So everybody's Thanksgiving was good, right?
Me.
Sarah, you were at your
What?
sister's. That was good.
Yes.
Yeah,
Going
mine was
to
good.
Thanksgiving, yeah.
Very quiet. Trey, you were here, right?
No. So we were off. Oh, I'm
you
sorry,
were
in Dallas. Yeah.
You were in
I was
Dallas.
in Dallas, yeah, for sure.
Yeah,
I gave
cool.
away gifts at my Thanksgiving. For my
You
family.
did?
I did.
Like gifts.
I
Is
went
this
out
like
and-
a tradition or?
No, well, it is now because this is the first year. But I played like a game with my family, and they were all able to like win these gift bags that I had like bought and prepared.
That's really cool.
It has some stuff in it.
I think I told you guys we do the bingo, right? Like the white elephant bingo.
Oh yeah.
Yeah. We do that for at Christmas.
Oh, you did it at Christmas?
But it's because our family started getting so big with
Oh,
like
right, with
grandkids
gifts.
and
Yeah,
all that
right,
stuff,
gotcha.
and
Yeah.
like it's like you end up being like you're bringing like 20 gifts.
Right.
To
it just
dinner,
gets like
and it's
it gets cumbersome.
you don't even know who like.
Who are these people?
It's like yeah.
Am I
I'm like,
related to
I
you?
just bought like a pair of socks for my uncle. Like why would I buy a pair of socks? Like he doesn't care.
Right.
That's a great gift though. Socks are actually a pretty good gift
Yeah,
nowadays.
socks are a winner, man.
The older
Especially
you
like
get-
nice socks. You know,
Yeah.
if you're getting just basic ones, but like a nice pair of socks, like that's a good gift, Sarah.
Thanks.
Yeah.
Don't sell yourself short.
Oh. Well.
All right, let's move into some segments. Did you guys see the internet blowing up about Lindsay Lohan?
Yeah, of course. I love her.
I love her.
She looks great.
Oh my gosh, she looks amazing. So, our first.
But I feel like I will say this.
Yeah.
I've watched her movies, like one of her recent ones that's on Netflix.
Okay, how is it? Like, because I haven't. Is she good?
It's very Hallmark, Lifetime type thing. But it's funny. It's cute. It's a Christmas movie.
Okay, but
So it's kind of
she's like doing a
cringy.
good job.
But yeah, she's great. But like, the difference between her like Instagram pictures or social media pictures versus her in a movie, real life, is different.
Yeah, way different. Totally.
You
Yeah,
can
Instagram
tell-
is not real life.
You can tell that
Instagram.
those pictures
well,
are
good.
edited.
You're gonna have to circle back around to that.
Yeah.
So I think Lindsay Lohan is making a comeback.
course
You
she
know, she's 38 years old. She hit the red carpet last week to promote some new movie. It might be the one that you were
Yeah,
talking
it was
about.
that one.
And I have to say, she looks bomb. So this is about, did Lindsay Lohan have plastic surgery? There's her picture right there. Wow, she looks just utterly like amazing. She looks fantastic.
Very symmetrical.
Great. She looks great.
Yeah.
And so, of course, when that picture hit, internet's going crazy. Like I've just been following it for the last week. Well, it's been a little over a week, but a week or so. And of course, you know, everyone's saying, oh, she's had all this surgery. And there was this one article by this really kind of sketch place that said she had $300,000 worth of surgery.
Well, they don't take into consideration that she used to be like a drug addict
I know,
and an
right?
alcoholic.
I know.
Like,
All right.
when you stop doing all that stuff, you
and Sarah,
actually turn out
that is
looking
exactly
pretty
what was
good.
on my next comment, and I'm glad we're on the same wavelength
Yeah.
here. She obviously looks way different because she was insanely strung out for many years. She had to go to like court-ordered rehab 6 times, I think.
She was
Like she was looking rough,
She was losing her life.
and she was
So
you know
that's
gaining
for-
weight and
yeah.
losing weight, and I mean she wasn't taking care of herself, and I don't know what all she was using, but I mean, I'm not like dogging on her because you know.
Yeah, if you look back at pictures, you can tell when she started drinking a lot because she started gaining weight.
Yeah.
And then you can tell when she started doing drugs because
She
looked
got really skinny.
so skinny.
Yeah.
And, like,
so
skeleton
obviously
looking.
she's gonna look different. So I'm not surprised that people were, you know, questioning if she had plastic surgery because of this dramatic change. So I got some comparison pics, Travis. I think I got 3. Throw up the first one. So that's one of like her pics, I think, when she was in court, and she's looking a little rough. She's looking a little.
She looks like she had been crying, but
Yeah.
she still looks not bad.
I agree with that. Even like at her worst, she still looks good. So obviously she could clean up and look amazing. Now,
Yeah.
she does look very different in that picture. And, you know, in that picture, I mean, her lips are different. Obviously, she looks like she's been crying because she's got bags under her eyes, which at this time she's only in her early 20s, I think. So
Yeah.
it's not like she has, you know, real blepharoptosis or extra eyelid skin. I think she'd been getting some fillers. So
Yeah, her lips look plump.
yeah, so I mean, she looks pretty rough on the right side. So throw up the next one, Trey, if you would. Okay, so this is her when she was a little bit, you know, I guess not in a bad way. And she does look different. I think she has a lot of cheek filler in on that old picture, which is the right picture. Also, she is making a different face, which totally changes things. You know, sometimes people will compare a picture of somebody with a very passive face to where they're smiling really large and say, oh, look, they have lines under their cheeks. Well, yeah, of course, even a teenager will have lines under their cheek if they smile big.
Yeah.
And especially
the
when you
camera
get
angle is different. The one on where she has like super blonde hair.
Uh-huh.
It's like more, the camera angle is more facing up because
Correct.
you can like, she just
Right.
looks like she's.
I agree with
so
that.
it makes her nose look different.
It does.
Because she's always had a cute little nose.
Yes.
Like, I don't think she's ever gotten a nose job.
I don't think so. When you look at some of these angles, it's like you question it, but you're exactly right. The angles of this picture, although at first glance may seem very similar, the one on the left is kind of a worm's eye view where you're looking up, and the one on the right's more of a up to down view.
And her makeup's done completely different.
It is, and she has more freckles in that picture. Like her hair's different. Look at her eyebrows; they're way different. So yeah, she looks totally different. But I'm not sure there's anything surgical there. And then throw up the last one, Trey. I think it's reversed on the next one. Yeah, I mean there she's got all kinds of filler. She looks like she's a little bit heavier. Her lips are not as well done on the then picture.
It looks like she's drunk.
She does look a little.
Because her lipstick's all smeared.
It does look a little questionable. I don't know where I dug that one up at.
She looks like she just got back from like a little party.
So obviously, Lindsay looks amazing right now. I think she looks gorgeous. I don't think she looks her age of 38. And so people are questioning, did she have surgery? And someone asked her about it recently. I think it was Allure magazine, if I remember correctly. Don't quote me on that. But she claims the things that she's used are really good skincare, cleaning up her life, obviously, and then Morpheus, which we've talked about a bunch. IPL, specifically BBL, which is broadband light, which is a type of IPL, and then laser treatments.
Not the butt thing.
Not the butt things. And then laser treatments, which if she's using BBL, she's probably using the Cyton lasers like Moxie or Halo because
Do you have all that stuff at your place?
I do. She's using all the stuff we use, which it makes sense because when we went to buy machines, we're like, what's the best in the industry?
Yeah.
Because
you use Morpheus on your face, right?
I haven't. I want to. I've used Halo.
Okay.
And I'm due because I feel like I was going to talk about my birthday. That's what I was going to talk about.
Yeah.
I turned 50 yesterday, but I feel like I look a little old right now, maybe older than average because it's been over a year since I've done a treatment. And I really believe in those treatments. Like I saw really good results.
You just need to get Botox. Like
God, you sound like my office manager. She's been telling me that
if you want to look younger, that's
No,
what
because
you tell
it's
us.
different though. You know that. Like Botox is good here. I'm pretty good right here, but I'm starting to get a few wrinkles. But I'm more like want to fix this. Because I am getting older. Like it's hard to admit. And so, I'm going to fight it because why not? I got the machines in my office. But I haven't done the Morpheus. I want to do that one because people say that one is great.
Yeah.
I just got such great treatments with the laser. When they brought the laser in, they did a treatment on me. And I was like, oh, sold because it was just so good.
Yeah.
So that's why I've been using the laser. But I do want to try the Morpheus. My wife's done that one. She likes it. Although she says it's a little spicy, but she thinks everything's spicy. So, but yeah. So anyway. Yes, she said that she's done these non-surgical treatments. So, all right, guys, what do you guys think? Trey, I'm starting with you because you look like you're deep in thought in there. Lindsay Lohan, you think she had surgery or not? There's no right or wrong answers, man.
I don't necessarily think she had like surgery, like plastic surgery. I do think she had like some procedures, I guess, but
yeah, so
maybe not
non-surgical
plastic
stuff.
surgery. Yeah, non-surgical stuff for sure.
Sarah?
Yeah. I think she's definitely had Botox.
Oh, totally. I mean, she admits that she's had non-surgical treatments.
Yeah.
But the internet's like saying that she had like under the knife surgery.
Yeah, like a facelift.
Like a mini facelift or like a blepharoplasty, like an eyelid.
I think makeup can do some like.
Oh
really
my
amazing
gosh, you're
things.
so right.
Yeah,
Absolutely.
makeup can do some crazy things.
I've told you, like people think, like one of my friends, he thought that I had a nose job just because of the way I was putting on my makeup.
Yeah, putting on your contour and stuff.
Yeah.
Yeah,
We've
talked about that a lot.
No.
So I agree with both you guys. I wouldn't bet my life that she didn't have something. She may.
Because she's a celebrity, so
she conceivably could have had some minimally invasive, either facelift or endoscopic facelift. But I definitely don't think that it's absolutely for certain. And if I had to bet, I would guess no. Because I know those treatments that she's talking about them. We use them. We see great results with them. In fact, Trey, I think I have a pic of, this is not Lindsay, but this is another person that had a pretty dramatic treatment. And at first glance, you look at the person on the left, you look at the person on the right, and of course, like most of it's her skin's clear, but also her skin's tighter. And I think this is this is just purely like IPLs and lasers that basically just cleared up this girl's skin and just kind of generally tightened things. And to me, she looks like way younger.
How much does a procedure like that cost usually?
So if you're talking about like IPL plus a laser, I mean, you're looking at like, $2,500-ish for like the full treatment.
And how often do you have to do that?
Well, you don't
like,
have to
maintain it?
do it. I mean, I like to do one once a year, but you don't have to do that.
Yeah.
I mean, I saw good results just from like one treatment, one series of treatments. And because of that, I wanted to go back and do it again. And so, I mean, if you're really serious, you could do one every year, every other year, or swap. My wife swaps between the Halo and the Morpheus every year.
Oh, okay.
And she looks great. I mean, she doesn't look her age.
Do.
Yeah, she looks fantastic. And she has not had any surgery on her face whatsoever. It's just non-surgical stuff. So I think it's very possible that Lindsay got her results with weight changes.
Yeah.
We know her weight's kind of under
being
control
healthy.
now. Skin care. She talks about skin care. She is admitted to doing intense pulse light and broadband light treatments. I know those do good. And she's admitted to doing Morpheus as well as lasers, which I assume she's using the in-mode lasers because she spoke specifically about BBL and they're on the same platform.
Yeah.
Like the BBL machine has the in-mode laser. So, as I said, is it possible she had surgery? Sure. Does my gut say that she's had surgery? No. I think she's done what she said, which is to do non-surgical treatments, because those treatments are literally made for people in her age bracket. Like 30 to 50 is like prime territory to use these machines and just see like banging results. You know, if you're 75 coming in to get a laser, yeah, it's going to help you. And we do have people that do it at that age, but you're asking a lot of a treatment, a non-surgical treatment at that point to try to correct that much aging.
Yeah.
And so I do think that she absolutely could have gotten those results just by cleaning her life up, getting some skincare, doing some non-surgical treatments. So these people saying that she spent $300K on plastic surgery, I think that's just nonsense.
I think it's silly because it's like, why does, like, one, who cares? But
Right.
two,
Well, I mean, people care.
yeah, because they're
I
like,
mean,
how did she look this
No
good?
one should grief her, but,
Yeah.
but people do care.
But I think it's good that she's being truthful about it.
I think so. At least
I
she
think
said,
she is.
because she could have said, "Oh, I'm not going to say,"
Yeah,
but
she
she's
could have said, like, I
Yeah.
haven't had anything done, and
yeah.
you can't.
But she
'cause-
was like, "No, like I've done Morpheus,
Yeah.
like she said it by name. I've done IPL and BBL, and I've done some
Mm-hmm.
lasers, although she didn't name those."
You know who says that they haven't ever had done anything to their face?
Who?
What celebrity? Just guess. Like they've
Well,
never
Shania
done
Twain used to
anything.
say that, but that's totally not true anymore.
It's Paris Hilton. There's an interview.
That is such a lie.
There's an interview of
such
her
a lie.
saying
I'm
that
calling Paris out.
she's never had Botox. There's
That's
an interview.
Totally lie.
I know. I was just like,
I'm gonna look that
girl.
up because that's just
Yeah,
that's just
go look it up.
That is, I'm gonna pull it. It's preposterous.
No.
It's preposterous to believe
No,
that.
you can totally tell that she's had work done.
I'm sure she has. I mean, I haven't like done a deep dive, but I mean, why wouldn't she? I mean, she's a
like-
socialite, internet
She's an
celebrity.
heiress.
Yeah, so she's absolutely done stuff. So I'm calling shenanigans on that claim.
Yeah.
Shenanigans. All right, hey, let's recap this one, Trey. So today we were talking about Lindsay Lohan, who broke the internet with her recent appearance on the red carpet, where she looks dramatically different, and I think personally looks absolutely amazing. Now, the internet was abuzz saying that she had plastic surgery under the knife, and we were discussing, is that true or not? Well, I have to say that they were comparing some pictures of her in some pretty rough times to this picture, which I think is not necessarily fair and might make people believe that she's had something dramatic like surgery at the young age of 38. She did admit to having Morpheus, which is a great microneedling treatment, IPLs and broadband light, which are light therapy, as well as lasers. And I actually have all of those machines myself in my office, and I have seen them do utterly amazing things. So is it possible she had plastic surgery? Sure. Does my gut say that she's had plastic surgery on their knife? No. I've seen the treatments that she admits to using give amazing results, and I think that she got those results from that, plus cleaning up her life and using good skincare. So at least in my opinion, I'm going to say she hasn't been under the knife, at least on her face. So if you want to learn more about it, check out that episode. We got the full thing online. Cool.
Agreed.
Real quick too, Dr.
Yeah.
Herman. Morgan Rainey.
What's up, Morgan?
On
Oh,
Facebook.
she's going to yell at me, I'm sure.
She said, "You tell him, Sarah, he needs Botox."
Oh, my God.
Got him.
Got him. Thanks, Morgan. All right. Let's move on. You guys are going to like this one. This is... we actually touched on this a couple months ago, and I said I was going to do a segment on it, and I never did.
Oh yeah, I almost forgot.
I
what
forgot
the segments
to.
Were,
And then
you
I got
just
some
said them.
I got some media requests to do this. And I was like, oh my God, we need to do a segment. So this is a segment about surgery to change your eye color, specifically keratopigmentation to change your eye color. Whoa, look at that picture. Yowza.
She's trying to be on Twilight or something.
Dude, she is on Twilight. And honestly, I kind of dig it. I know that's weird, but I kind of like the bottom color. I was really interested to take a deep dive on this. So this kind of went viral on social media. Sarah's shaking her head at me. This kind of went viral on social media this past year. Well, a year to year and a half. And we briefly talked about it when we were talking about the 10 weirdest plastic surgeries or cosmetic surgeries.
Eye color change.
Yeah, about eye color change. And so I want to do a deep dive on this, but I'm specifically going to talk about keratopigmentation, but I'll just very briefly talk about the other ways that people change their eye color. So the craziest way is with an actual iris implant. So the iris is the colored part of the eye, which gives the eye the color. And there is a surgery where they actually ablate that color and then they put an implant in there. I guess.
Like that picture that you saw, like that you put up there?
No, that's keratopigmentation.
Okay.
No, that's keratopigmentation. So iris implants is what's to be considered an intraocular procedure. So it actually goes inside the eyeball. So immediately, for me, doing that for aesthetics, I'm out. Like
that's a no from me, dog.
That's a hard no, like a double hard no.
In my eyeball.
Full stop, no way. The other ways that you can change the eye color is scleral tattooing, so literally putting a tattoo on the eyeball. I'm not sure how I feel about repetitive needle pokes to my eyeball. So although this is extraocular, I think I'm going to hard pass on this one as well. Now, that leaves keratopigmentation. Have you guys heard of this? You may have heard of it on socials. No?
I've
Right.
not.
Is it
No.
closer related to like a laser, like LASIK surgery?
Bingo.
Okay.
Sarah's on it. Yep. So, keratopigmentation. Of the ways to change your eye color, this is definitely the most reliable with the least amount of risk, considering you are working on your eyeball.
Sold.
So, sold? You're in?
I mean, I'd rather, out of all of those ones
If
that
you
you
had
talked
to,
about,
yeah. If someone's putting a
I'd
gun
rather
to your
get the
head,
one that's like closest to the one that gives you 20/20 vision.
Right. Okay. Very good. I think that's a smart call.
The
So
safest.
with this procedure, it uses the laser, just like
Okay.
you said, to make a 5 millimeter opening in the cornea, which is the transparent part of the outside of the eyeball. And what they do, and I'm gonna throw a picture up there, Trey. That's like here, cool. Eyeball cross section. So the cornea you see on the very left side is that thin layer. It's a transparent layer that covers kind of the internal parts of the eyeball. And you see the iris. It's actually, I don't know why they colored it red, but the iris is the red part there.
That gives you the color of your
That gives
eye.
you the color of the eye. So what they're doing is they're making a slit in that cornea and making a space in there, and then they're injecting this pigment to cover up the iris. So it doesn't actually change your iris. It just masks it. It's almost like a colored contact.
Like getting your hair highlighted or something.
Kind of, but
But it's not
but,
like, you're not dyeing it. Maybe like a fingernail polish,
yes,
like a
but
polish.
Yeah, similar. Yeah, okay, that's
Because if you dye your hair, that's like chemicals.
right. Well, I guess pigments are chemicals. I don't know.
But it doesn't like. Can you take that out of your eye?
That's a great question, and I will jump ahead and answer your question, sort of.
Okay.
Sort of. This is, of the three, definitely the least invasive because it's considered extraocular because you're not getting into the actual internal parts of the eye. It's all in the cornea. The results are, let's
Okay.
just look at them. All right, so I got a couple here. Throw up the first one, Trey. Okay, so obviously before is up top, after is below. The thing I noticed about these keratopigmentations is they do seem very unnaturally colored. I also, if I'm going to be super critical, to me it almost looks like the color on the bottom is not perfectly round. Like, doesn't
Yeah.
it seem like the pupils are almost oval a bit?
It almost looks like very like froggy.
Like a replicant from, what's that, Blade Runner? Isn't the Blade Runner the ones that have the replicants?
Have you ever seen that show like on Cartoon Network or like Adult Swim or something? And like
Which
those
one?
cartoons that have like the squiggly, instead of, like a cartoon has like a black dot for a person's eye.
They have squiggly eyes.
And it's squiggly.
Looks like that, you think?
Yeah, you know what I'm talking about? The one
No.
with like the
I'm
crazy
gonna have to
uncle
look
with the
it up.
crazy hair. I forgot what it's called.
I'm gonna have to look it up.
Maybe it's on Comedy Central or something, one of those cartoons on there.
It's probably one of the things your kids watch.
No, my kids do not watch Comedy Central. They like cuss.
My daughter's always trying to get me to let her watch South Park. I'm like, no. All right, let's see the next one, Trey. Throw up the next one. Okay, that one looks
one
pretty
looks
good.
better.
I like that one. It looks cool. I do like the way it looks. I'm getting interested in this.
Does that make you want to get that, Trey?
No.
Trey's like, absolutely no.
Instantly, no. I don't mess with my eyes. Like I can't even put contacts in.
Oh, wow.
It looks way better on that screen, dude.
Oh, it does. Wow, the second screen does look way better. Okay, all right, let's see the third one, Trey.
That other screen's a loser.
Gosh.
Oh, wait, no, back up. That's
Oh,
me. That's
not
me when I
that
had color content. Wait, isn't there a third one, or is there?
No,
like
there
two?
was no third one.
Oh, really? Oh, okay. Well, just imagine something very similar.
Everybody on the second one, it looks like not only did they get their eye color changed, but they just got done crying about something horrible.
Maybe they got the bill. Which brings up a good point. How much does this cost?
And hurt.
Wait, I think we do have one.
Oh, there it is. Yeah, there's the third one. Yeah, I just got out of line. Yeah, so that's like a gray. I mean, that's kind of cool, honestly.
Yeah.
Yeah. So what do you guys think this costs? Still a number out there.
$3.99.
Free 99.
That'll get you the console.
I think
The console.
1,500.
Wow. 12,000.
Gross.
12,000. Now, this is done by ophthalmologists. This is not a plastic surgery procedure. Let me be very clear about this. Done by an ophthalmologist, which is not an optometrist, which is the person that you go, get your glasses from. This is an ophthalmologist, the person who would do like LASIK surgery, okay, because they're using the same equipment. It takes about an hour, costs about 12 grand. It's gaining popularity in the United States. I found 2 surgeons in the United States that have pretty big web pages about it. One's in New York City, the other's in Los Angeles.
So that brings me to my question: is how long has this been around, and how like these doctors that are doing it? It's like how long have they even been doing it?
It's been around. So you're right. It's not FDA approved. It's off-label.
Okay.
The laser to use it's been around for a long time.
Yes.
And the pigment has actually been used for medically necessary procedures.
Okay.
There are things that can go wrong with the iris where you want to use pigment to cover it up.
Okay.
Like for one, albinism, where like you have the red eye. Like nobody wants that. Or maybe they do. I think it might be cool, but a lot of people would not want it. So they're like, huh?
I said you're such a weirdo.
I'd be like, I don't know, I kind of like the red eyes. It's like, I feel like Darth Vader or something. So there are medical reasons that people do this. So it's not brand new.
Yeah.
But it is new that it's being used for cosmetic.
Yeah.
Like for somebody's like, look, I think I just don't want to have
Just because they want to.
brown eyes anymore. Now, let me just let you guys know that in January of 2024, the American Academy of Ophthalmology issued a warning about eye color change. Look at that. Wow, they are letting people know that this can carry serious risk of vision loss and complications. However, let's be fair, the AAO, as they are sometimes called, lumped all of these things in together. So they were talking about iris
things that you talked about before.
Iris implants, scleral tattooing.
Those 2 other procedures.
And I do think that this keratopigmentation, because I did a little bit of a dive on these 2 guys. They've done somewhere between 500 and 1,000 each of these. And I actually watched a podcast of one of them, and I was like going all in on this research here because I want to bring you guys like literally the best information. You're welcome. And so this guy was saying,
because you secretly want to change your eye color,
dude, I'm a little interested.
and get some crazy colors so you can audition for the next Twilight.
No, I just feel like I would just look cool with it. But you're getting me. I was on the soapbox here. You're really derailing me here. So I totally forgot what I was going to say. Oh yeah. So these guys were saying that the risk.
It's your birthday. I'm just kidding.
I know, right? Squirrel. These guys are saying that they are not seeing anything crazy from complications risk. Now these are board-certified ophthalmologists using excellent equipment. This is not get your eye color change in a van down by the river. Like these guys are really good, okay? And so the number one thing they're seeing is light sensitivity, which is one of the risks that the AAO was talking about. The other risks include damage to cornea, reaction to dye, infection, of course, and then color fade or leakage. But these guys are saying that really the only thing that they're legitimately seeing is light sensitivity.
Well, I can see that because it looks like most of the people are going from brown eyes to blue eyes, and blue-eyed people naturally have light sensitivity, don't they?
I'm not sure that holds up, Sarah. I'm going to say okay, but I'm going to say I'm not.
I always see that
sure.
when people have blue eyes.
I don't think that but it doesn't make them have the same things the blue-eyed person would have. I think it's the surgery that gives them the light.
Well, that's probably true too.
Yeah,
but I've always.
But like, it's a good comment, and I appreciate it because like it's making you think. Yeah, I agree.
Yeah, because anytime somebody
if they're
I
blue
know
eyes,
that have blue
they're more
eyes,
sensitive.
immediately.
What about like the red-eyed people? They're probably very.
I've never met anybody with red eyes.
I know, I'm about to get red eyes just so you can say you have. Okay, so now these guys are saying that they're seeing good results, but there is not a lot of data on this. Like there's not tens of thousands of people that have had this. So also one last thing is it can be partially reversed, as you asked. Yes, they can potentially take the dye out, although it's not 100%. You might have like a tint left behind, and they can also partially change it. So like say you got blue and you don't like that, You could probably change to green, but you probably couldn't go to red. You can change to something that's similar, like maybe like a secondary color, right? Like the primary colors and
like a purple.
Purple maybe, yeah, absolutely. Purple would be pretty dope. So, my opinion on this. Well, I'll get to that at the end. Would you guys do this, Sarah?
I would do it if it didn't sound so scary.
So maybe. Not right now, but maybe in the future.
I wouldn't change my eyes to blue. I would change it to where like maybe my brown eyes are like brighter or something.
Ooh, cool. I like that. So you would do like an
more
accent.
Like honey
I love that.
Colored.
I love
and
that.
And not so much like strange.
Trey, I know what you're going to say. You're absolutely no, right?
Yeah, I'm absolutely no.
You can't put in contacts. You're not letting somebody poke your eyeball with a laser.
I'm not an eye guy.
I feel you, man. Yeah. I feel you. So I feel like that right now, I wouldn't encourage anyone to rush out and do this. I will say I am not as pessimistic about it, having done the research that I was when I first saw it. Mm-hmm. I think that the two guys that are doing it, and I wish I had written their names down, they're probably easily findable on the internet. Their results look pretty good. These guys are very established, certified ophthalmologists. I think that this definitely could be something in the future that might be a little bit more mainstream. Mm-hmm. As of right now, it's just early. And I hate to be the first person to jump on some new treatment. So I'm going to pass right now.
Oh, you know the question I just thought of?
What's that?
So like whenever you're at the doctor and you say, do you have blue eyes, like on your driver's license, do you get to change it?
Well, I mean, I don't think
what if your eye color is red now and you're a brown-eyed person?
You probably have to tell them you changed it, yeah.
Y'all would not let go of this red eye.
I won't let it go.
So
if I could change my eye color to any color, it probably would be green. If I was
okay, that's a good question. So you would do green. What would you do, Sarah? You just accent yours?
I'd just make it like brighter.
So I will tell you, the reason I'm mentioning this, I used to color my eyes all the time with contacts.
I was like, what?
Yeah.
It sounds like you're like color.
No, with contacts. In fact, that last picture is me, where above I had green, and it doesn't show up great, but the bottom one was a gold, and I loved it. Oh my God, it was just so cool. People would always comment about it, because it was kind of brown, but it was just a little bit.
Yeah, like that's like how I'd want mine.
It was just a little bit too goldish to be unnoticeable, and I absolutely loved it, and the only reason I quit doing it is the company that made that particular contact quit making them.
Do you wear contacts now?
I do, but I just wear clear because.
My friend in high school, she had like super dark brown eyes. It almost looked like her whole eye, like it was like her whole iris, or not her whole iris, like her pupil. Like she just looked like they were almost like black.
Right, because they were so dark.
Yeah, and so she had these like crazy like turquoise colored like blue, like ocean blue color.
Yeah.
And it was like crazy, but you could obviously tell it was fake.
Yeah, I had all kinds of colors, but I loved the gold so much. I'm like, and they were like, it was like a metallic gold. It just was so cool.
Real quick, we got a couple comments on YouTube.
All right, let's hear it.
Invisible Ship Bills. He said, leave Paris alone. I think Paris Hilton is who he was talking about.
Okay.
And J. Travelli said, never do LASIK for some reason.
Never do LASIK. I've had, so the research will say that LASIK is safe, but there are a certain percentage of people that will have side effects, like halos, or they have to get it redone. Like one of my really good friends got LASIK, and it was great, but then he had to get it redone in 5 or 10 years. Yeah, I don't know. I'm going to pass on LASIK because my vision is really not bad until like 2040, so I'm not getting surgery on my eye for 2040. But yeah, thanks for those comments, you guys. We do appreciate that.
Yeah, I think that was like the most we've ever had.
And we're not even done yet. All right, let me recap this one real quick, Trey, and then we can go on the last one. So today, we were talking about surgeries to change your eye color. What is this sorcery? So there are a few things out there to change your eye color. One is an implant for your iris, which is the colored part of the eye. Next is scleral tattooing. Ooh, that sounds scary. And the one that we were talking about the most was keratopigmentation, which is actually an extraocular procedure, meaning it doesn't get into the eyeball itself. And what they do is they use a laser, the same one that might be used for LASIK, to make a small slit in the cornea and then put a pigment over the iris to cover the color up and get the color of your choice. And this is a pretty new thing for a aesthetic treatment. It has been done for medical reasons in the past. There's a couple people, at least in the United States, doing a good number of these. And I have to say that I'm not as pessimistic about it as I was when I first started diving into this topic, because these guys are having pretty consistent results with very low complication rates reportedly. One of the biggest things they say is light sensitivity. This will cost you about $12,000, of course not covered by insurance. It is partially reversible, and you could potentially change the color, so you have to think really hard about if you really want to do this, because it's not a simple swap if you want to change it. So this is definitely new. I can't recommend that anyone do this because there's just not enough numbers out there to prove that long-term it's safe, but I am interested, and I think it's cool, and I'm going to follow this one. So if you want to see the whole segment, check it out. We'd love to get your comments. So, all right, last one. Now, you guys may or may not have heard about this one. Did you guys hear about this controversy that blew up about Anthem Blue Cross in covering anesthesia?
The only reason I saw anything about it is because of that
the guy,
the housewife girl that was on here. She made a comment about it.
Oh, she did. Oh, right, because she's an anesthesiologist,
Yeah,
right?
I saw.
Yeah,
I saw a thing about it.
You did.
from
Okay,
her.
Trey, did you hear about this one?
Mm-hmm. I did.
Okay.
Yeah, I did.
So I'm going to break this one down for you. People were actually asking me about this, and I know a little bit about it because anesthesia, obviously I'm not an anesthesiologist, but I'm a surgeon, and we work with anesthesiologists all the time. So there was a big buzz on social media this past couple weeks because Anthem Blue Cross Blue Shield, specifically which represents Connecticut, New York, and Missouri, said that they would no longer, they said this last month, they would no longer pay for the extra anesthesia time in a surgery, meaning if surgery is supposed to last 3 hours and it goes past that, then anesthesia would bill for that time after, and up to this point, the private insurances would pay some part of that for the extra anesthesia time. And Anthem Blue Cross Blue Shield said, hey, we're not going to do that anymore, meaning we're going to pay you per procedure, not for time, all right? And after this happens, the American Society of Anesthesiologists went on the offensive. They put a post up, throw it up there. This is just the title of it, so you can look it up if you want to see it. This is from the American Association of Anesthesiologists. Anthem Blue Cross Blue Shield won't pay for the complete duration of anesthesia for patient surgical procedures. They went on to just basically lambast these people and say that they were more or less killing people.
And then like, I guess this is kind of on topic, but then that guy that's a CEO of a health insurance company.
Yeah, that's a completely different. I thought about doing that one, but it was kind of morbid. Obviously, everyone's heard about the CEO that got shot. I mean, this is not related to that.
But I think it's funny because it was just that title. It said another way insurance is like costing patients or something, affecting patients.
Yeah, like the article that the
like
Americans.
There's some kind of like evil villains.
Right.
Or something.
Well, exactly, and so that's exactly my point, Sarah. Is that when Blue Cross, announced this, the anesthesiologist group, who their lobby is actually fantastic,
well, it's a really good profession, one.
It
So
is,
it's like,
and they're
so
very
sure-
cohesive, these guys. They're like a gang, man. Like, surgeons are not like a gang. Like, we don't gang together. We're just fighting between each other. We're like tribal people, like, fighting while anesthesiologists like the Roman army. Like, these guys are together. And they went on the offensive, and it worked because they know that the American populace really, if one thing the American populace can agree on is we hate insurance companies. I don't like insurance companies. I'm sure you don't. No one does. Who likes the insurance companies? No one. And so they went on the offensive, and they said that this is a terrible thing, and it got picked up on social media. And then all of a sudden this last week, all I saw on my feed was literally everyone saying, oh, this is terrible, and surgeons are like, I'm going to have to wake my patient up before I can finish the surgery.
What?
And honestly, a lot of it was just really sensational.
Dramatic.
It was just kind of over the top. So I want to break it down in a very neutral kind of way because I'm kind of neutral about this one, to be honest. I certainly was not the person that was saying, oh, this is the worst thing ever. And let me tell you why. This was aimed to prevent anesthesia overbilling, which is what I said, where anesthesiologists will send a second bill after the initial bill has been sent out. And this is an issue. No one wants to talk about it, but this is an issue. It happens to my own patients, where our patients will get second bills from the anesthesiologist. Now, we have a deal with our group, and I love my group. I'm not at all dogging them at all because they're cool. If one of my patients gets a second bill, we say, look, this is what we negotiated, and they will cancel that. But the group I work with is not every group in the country, and other people are going after more money, and that's what they were trying to stop. And let me be clear that this method of paying for procedure is what Medicare does. You know, Medicare, which is considered one of the gold standards by some people of how, you know, healthcare should run. I mean, that's totally debatable, but Medicare pays by procedure. They don't pay by time.
Yeah.
You know, this is a private insurance thing. And so I'm a little bit on the fence about it, because when I do a surgery, you know, say I do a surgery, I'm gonna stay in the realm of plastic surgery with insurance. I mean, when I did general surgery, it was much more of a thing. But say I do a breast reduction surgery, I mean, that surgery could take me 3 hours, or it could take me 5 hours.
Yeah.
You know, it just depends on the individual patient.
That's like hard to tell, like say.
I can generally tell, but the point being that I get paid the same whether it takes me 3 or 5 hours.
Yeah.
If it takes me normally 3 hours to do something, but it takes me 5 because it's a hard case, I don't bill the patient. I don't send the insurance another bill. I don't ask the patient for more money.
Yeah.
So why would an anesthesiologist do that?
Yeah.
I don't know. I mean, just playing devil's advocate. You know, I'm playing devil's advocate. Also, too, if like, that patient has a complication and I have to take them back to surgery, I as a surgeon don't get paid for that. I get nothing. Anesthesiologist gets paid. So it's like, okay, well, here I am as a surgeon looking at this, and I'm like, okay, but this is how I get paid. I mean, I don't get paid if cases go long. And some people will say, well, that's out of the anesthesiologist's control because they're not a surgeon. Well, it's out of our control. You know, unless you make a mistake, which with a good surgeon's not going to happen. If a case goes long, it's because it was a hard case. So playing devil's advocate, I was just kind of like, you know. I mean, on the one hand, there's a group of doctors getting squeezed, which is what's happening. The anesthesiology groups are getting squeezed by the insurance, or they were attempting to do it. And I'm like, well, okay, but I mean, that's what I'm dealing with. So it's like, am I going to like fight over this? No, I personally am not. Of course, they're going to fight for it, because that's money out of their pocket. So, yeah, I think that this is more, you know, I think a more neutral discussion than the sensationalism that we saw on social media the past week. It was kind of like ridiculous, honestly, what people were saying. And I would just be like, yeah, but that's how we get paid. Like surgeons were talking about it. So anyway, but the end of the story is that because of this social media backlash, Blue Cross backed down.
Really? So it's done?
They backed down. It's over. Yeah, as of day before yesterday, they backed down. And so, you know, I want to applaud the anesthesiologists. They basically banded together and started this firestorm about this, you know, kind of very random sub-billing thing and made it this huge ordeal, which it's really not. I mean, the amount of money that they probably make for that is probably just a small percentage of their total income. And you know, it's just like anything. If they got squeezed out of that, they'd figure out another way. I mean, just recently, our anesthesia group started billing our surgery center per day, you know, to make up income. And it's like, well, okay, it's just the price of doing business.
Right.
So you know, people make up money, but it was just interesting how it all played out. And you know, I'm definitely not on the insurance company's side, pretty much on anything, but I do think this was more of it's kind of like
you can see it from both sides.
I can see it from both sides. You know, I mean, overbilling is a problem. You know, not with every group, but with some groups. And you know, and there's every specialty that potentially will find ways to squeeze more money out of. You know, everyone's trying to squeeze more money out of the turnip, and the turnip is really kind of squished at this point. So, but that's basically what went down. Yeah. So I think it's interesting to know, you know, because you see stuff on social media and it's like, what's real and what's not real.
Yeah, and this stuff didn't apply in Texas.
No, it didn't apply in Texas at all. Yeah. Of course, it could essentially set a precedence, right? If Blue Cross does this in those 3 states and they manage to pull it off, then other Blue Crosses would definitely take note.
Company-wide.
You know, and it might get bigger. So that's why it's like, oh wow, this is, you know, slippery slope. Yeah. So anesthesia group was like,
so they were like, we're gonna throw up.
They threw up the shields and threw down the spears and like, absolutely not. And I applaud them, man. I mean, if there's one thing that you can get people riled up behind, it's behind hating an insurance company. I mean, that's facts. Yeah. And so anyway, all right. I think that's all the time we got. Anything else to add, Travis, Trey?
I don't personally.
No, Sarah, we done? Is this it?
Yeah.
All right. I think we had a good one today. All right, everybody. Thank you guys so much for tuning in. We really do appreciate it. Thank you for the comments, you people out there. We love you. Please come back and comment again. Let us know what you want to talk about. And we'll be back next week on Nip Talk.
Bye.
Bye.